to have you with us today. This is our annual public meeting. Just so people understand, this meeting is actually a requirement of the New Jersey State Department of Health. We don't look at it as a requirement or an obligation. It's something that we're happy to do every year and welcome people being with us. Today, we're doing the meeting virtually. There will be an opportunity. It's not a live mic, so that we can assure that we don't get any background noise or interruptions. So there will be an opportunity later on for people to ask questions, and we'll certainly answer them. Before going forward, I do want to recognize that several members of our Board of Governors are also on the call right now. I want to acknowledge our board chair, Vincent Dix, along with Dr. Judy Caruso, Monsignor John Fell, Rochelle Fosu, Father Jay Toborowski, and also David Samuel, who's also the chair of our St. Peter's Foundation Board, our fundraising arm, and Dr. Maureen Cernadas, immediate past president of the medical staff. So I'd like to thank them for joining today. And again, the fact that we have so many board members, that's also a reflection of the support that we have from our governing board. And just also one other note, these are people that are not only very, very committed to St. Peter's, but they also do this as volunteers, you know, that they give up their time and their energy and their wisdom and in other ways also. So thank you to our board. We can go to the next slide. We always begin with our mission. St. Peter's is a Catholic hospital. I won't read the whole slide, but leave it there enough so that you can see it. But certainly we are a Catholic hospital in keeping with the teachings of the Roman Catholic Church and guided by our bishop, the Bishop of Metuchen, the Most Reverend James F. Checchio. And we are at the very core, as our mission says, committed to humble service to humanity with a focus especially on those who are most vulnerable, you know, among us that are not as advantaged. We minister to the whole body and spirit, preserving everyone's dignity and the sacredness of each life. We also have an educational role as part of our mission, and certainly are always committed to the highest ethical and moral principles as we pursue excellence and to assure that our patients receive the highest level of care and care that is safe. So we share with you again as part of our mission. This is our bishop, the Bishop of Metuchen, the Most Reverend James F. Checchio. St. Peter's is one of the few Catholic hospitals that remains in the state of New Jersey, and we also are somewhat unique in that most Catholic hospitals, not only here in New Jersey, but in the country, were founded by women religious and are still associated with communities of women religious or nuns. And in the case of St. Peter's, our relationship and sponsorship is directly with Bishop Checchio, for which we're very grateful. He serves not only as our spiritual shepherd, but also as our corporate head, is the sole member of the St. Peter's Healthcare System Corporation, and in fact, you know, does have all reserved powers in reporting the board and the CEO. So the bishop oversees our Catholic identity and, you know, and all that we do. And, you know, certainly we practice here consistent with Catholic tradition, consistent with Catholic moral tradition. And we abide by what's known as the ethical or religious directives for Catholic healthcare services, or the ERDs. And the ERDs guide all Catholic hospitals nationally in terms of their practice. So again, I want to just acknowledge the very important role that Bishop Checchio plays in St. Peter's. As we continue, this is an aerial view, you know, that was taken that shows our campus here as we overlook the park on Easton Avenue in New Brunswick, taken on a very nice day by Michael Castronova, and with the use of a drone. So Michael, thank you for that photo. But this is St. Peter's right here in New Brunswick. And as we go forward with the next slide, a little bit about who we are. St. Peter's is anchored by St. Peter's University Hospital, which is a major teaching hospital and the majority portion, by far, of St. Peter's healthcare system. This also includes the Children's Hospital at St. Peter's, which was the first of 13 licensed acute care children's hospitals in the state of New Jersey. St. Peter's is very well known as a children's hospital. We'll say more about that later on. We do have more than 900 community and employed physicians, a medical staff of over 900, about 200 physicians that are employed and very closely aligned with St. Peter's, as opposed to just practicing here with medical staff privileges as part of our staff. We have a workforce of full and part-time and per diem employees of about 3,700. St. Peter's is also a major teaching hospital, and that we have about 130 residents and fellows that also are continuing their graduate medical education here at St. Peter's. We are affiliated with Rutgers Biomedical and Health Sciences, and we also have medical students from Rutgers as well as medical students from St. George's Medical School. So a little bit about St. Peter's and who we are. We are absolutely a major teaching hospital and with a very important role in New Brunswick and the surrounding communities. If you look at us just by some of the numbers, we have more than 26,000 inpatients and medical observations. And I characterize medical observations, that's something that's becoming more and more common. Patients that used to be typically admitted to the hospital are now not admitted as inpatients, but they are admitted in such a way where they are here for observation, often, for short stays of 48 hours or less. So when we look at the number of inpatients and medical observations, they do number about 26,000. And, that does include the medical observations as well. Some 8,000 surgical procedures here at the hospital. And also not noted here is we have the CARE Surgery Center, an ambulatory surgery center where another more than 5,000 surgical procedures are done. So on our campus, we actually have over 13,000 procedures. Very busy emergency room, 67,000 for both our adult and pediatric emergency rooms. And of that 67,000, about 24,000 are for the children's emergency department. And St. Peter's having a very important role of who we are. We had 5,648 babies born at St. Peter's in 2024. We are one of the busiest maternity centers in the state of New Jersey. So we look on the next slide, just again by some of the numbers. We are, in terms of how we are organized as a hospital, we are a not-for-profit organization. And so we do have a substantial amount of community benefit that St. Peter's does as a not-for-profit organization. And if you look at last year, we can measure that as provided in our audited financial statements, literally about $109 million in community benefit. And of that amount, about $25 million documented in charity care for patients that are uninsured, and annual revenues of about $654 million in total. So we move to the next slide, a little bit more about the numbers. As a not-for-profit organization, it's still important that St. Peter's has a positive operating surplus or operating income from our operations. And, you know, organizations need this to recapitalize themselves. And, you know, even though we're a not-for-profit organization, that doesn't mean that, you know, we bring a dollar in and we spend a dollar. We have to have a surplus. The difference in being a not-for-profit organization as organized as a 501c3 under the Internal Revenue Service Codes is that St. Peter's is a community-based organization. Nobody owns St. Peter's in the sense of stockholders or owners. And so when we have an operating margin, it's not that any profits are returned to owners. Any surplus that we have from operations every year, and we need that to recapitalize and, you know, to reinvest and to have funds for a rainy day, goes back into the operation here. No monies go to owners or because we are a community-based organization. We do have, you know, a healthy, reasonably healthy balance sheet in terms of having days cash on hand. What that means is we could go 182 days if no revenue came into St. Peter's. We have about 6 months of reserves, which would help us in times if there were difficult financial times. We receive our monies in about 33 days. This is an important metric because hospitals being reimbursed for care is very complicated these days. When you look at the relationships with insurance companies and some of the issues we deal with there, and we pay our bills in about 64 days on average. You know, some much sooner than that, but on average. And you know, these numbers compare very favorably with others in the state. So moving on, you know, talking about St. Peter's and our future, we are one of the few remaining what I refer to as single hospital health systems. And that means that, you know, if you look at it in the state of New Jersey, where there are health systems that have at least 2, 3, 7, in some instances, as many as 18 hospitals in their system, we are one of about 5 or 6 in the state that a health system that has only one hospital. And so that's becoming a very unusual situation, you know, for hospitals in the state, because the vast majority, certainly about 65 of the 70 acute care hospitals in the state, are part of larger systems. We are in the process of changing that, where we signed a definitive agreement with Atlantic Health System back in January of 2024, and we are working through the final stages of the regulatory process that will allow us to complete a merger with Atlantic Health System, hopefully sometime over the next few months. And the most important aspect of joining Atlantic Health, and we feel very good about that, and the possibilities for the future in terms of greater access to capital and a greater critical mass that is absolutely needed for hospitals in this day and age. But most importantly, we will preserve St. Peter's Catholic mission, and that will also help to ensure our long-term success. But most importantly, I want to assure everyone that St. Peter's will continue, really planned to continue in perpetuity as a Catholic hospital. As long as there's a hospital operating here where we are at St. Peter's, it will be a Catholic hospital that will be fully adherent with the ethical and religious directives for Catholic healthcare services. And as part of our definitive agreement, we also have what's known as a Catholic Identity Agreement, a very extensive Catholic Identity Agreement that outlines the commitments that Atlantic Health is making to St. Peter's in agreeing to continue to be good stewards of the fact that we are a Catholic hospital and will continue that way. So that's excellent news. As we continue to the next slide, and I'll share some highlights in some future pages, but just take a few seconds to have you be able to see this. I'm not going to cover every one of them, but certainly, along with our mission, what's critically important is that St. Peter's provides high quality, compassionate medical and health care to the people that we serve, both on an inpatient basis and certainly in the community. And what you see here are some of the recognitions. Certainly Leapfrog A is very important. It's a recognition that we adhere to high standards of patient safety. In fact, on the last publication of Leapfrog here in the spring of 2025, St. Peter's had the third highest rating safety score of the 70 acute care hospitals in the state of New Jersey. So we take that very seriously, and it's something that we remain very focused on. So we move on to the next slide, something that's really the latest accomplishment that we're really proud of. And in the room, among the few people that are with me here in the boardroom at St. Peter's, is Linda Carroll, our Chief Nursing Officer and Vice President for Patient Care Services, who is our leader in patient care and nursing. Just yesterday, we were notified by the American Nurses Credentialing Center that St. Peter's was awarded its 7th consecutive magnet designation. And not just our 7th consecutive magnet designation, but also now magnet is also recognizing those hospitals that even among those that achieve magnet, which is a very significant distinction, but they are now awarding magnet designation with distinction. So it's a very significant distinction to be magnet to begin with, because less than 10% of the 6,000 hospitals in the United States are magnet designated. And so it's distinction within a group of very, very distinguished hospitals to begin with. So Linda, congratulations to you, the entire team. It's just a phenomenal acknowledgement. And, one other thing that I'll share is that if you look at the number of hospitals that have had 6 consecutive designations or more, literally about 0.3% of the hospitals in the country have that. The last time we checked, it was about 18. We don't have the metric now for how many of them we do. What is it?
We're the 5th to receive magnet for the 7th time worldwide.
Okay, so magnet not only is in the United States, but it also, hospitals internationally pursue magnet as well. So we now know that we are the 5th hospital worldwide to achieve 7 consecutive magnet designations. So, Linda, congratulations to you and everyone involved. And it's not only the nurses, but it's really the whole patient care team. And I do want to acknowledge that we have a prestigious nurse on our board, Dr. Judy Caruso. So, Judy, thank you, for all that you do to support nursing at St. Peter's. Your hand is on this as well, and you certainly are deserving of recognition too. So again, we'll keep moving. Some of the other accolades as we go through our ICUs, both adult and pediatric, are recipients of the Beacon Award, which really is a reflection of excellence in critical care nursing that's bestowed by the American Association of Critical Care Nurses. We've had this Beacon Award in the adult ICU 7 times and 2 times in the pediatric ICU. So again, it's another indication of excellence in nursing. Our adult emergency department just recently earned what's known as the Lantern Award for adult emergency care. Prior to 2024, our pediatric emergency department was noted as the first Lantern Award in New Jersey for pediatric nursing care in emergency nursing. So again, another important distinction. The Children's Hospital at St. Peter's on the next slide was also named as a certified autism center this year by the International Board of Credentialing and Continuing Education Standards. And again, another important distinction as part of the Children's Hospital. So these are just a sample. We could literally spend this whole hour, that we have for this meeting talking about the different recognitions that St. Peter's has achieved. And again, within these, I just would simply say, within all of the recognition that we have, we never rest on our laurels. Quality and continuous improvement is always a work in progress, and there's always more to be done. And so we recognize that, we never are done with our focus on quality, because it's always an ongoing process. And this is something too that not only our board and or our medical staff and our employees are committed to, but also our board of governors. We report regularly to the board about our various issues and accomplishments in quality. So it's something that the board holds us accountable to as well. So we move on to the next slide. This is a little bit of an eye test, but I hope you can see it. This just begins to share. This meeting is all about what is St. Peter's doing for its community, and how do we understand what the needs are for our community and how we meet those needs. And we don't do this just because it's required, and it is required that every hospital have a community health improvement plan, but we do it because it's part of our mission and it's the right thing to do. What you see here is a listing of where we have various physician practices that are directly associated with St. Peter's, both here at the main hospital, beginning on the left of this slide, with all of the various specialties that are here in New Brunswick on Easton Avenue. The list is long. In the main hospital, as you look at the first two columns here at the main hospital, I didn't count them up, but it looks like there's probably easily 30, 40, 50 different specialties. And then in the CARES building, which is on the campus, if you go back to the picture that we saw earlier, we won't literally go back to it, but that was the building on the far left of our campus, the CARES building. And we have a number of services there, our Department of Medicine, Clergy Health, and a variety of different specialties there. And that's actually 240 Easton Avenue to the left of the hospital campus. Our Family Health Center, which we'll talk a little bit more about later on, is located about 5 miles from the main campus of St. Peter's. And if our mission is demonstrated in all that we do in every place. But if there was one place that our mission is especially apparent, and in the population that we serve, it's at the Family Health Center. I'll talk a little bit more in a while, but we have adult primary care and specialty care there, general pediatrics and obstetrics and gynecology, women's services that are there at the Family Health Center, as well as what we call our 4 Keeps program, which is a program that provides partial hospitalization services on an outpatient basis for children. And then also our Child Protection Center. And as the name infers, it's a center that is geared to protecting children. And it's one of 4 such centers designated by the state of New Jersey. And we provide that service for children. We work very closely with community-based agencies and the courts. And we cover 8 counties, more counties than any of the other 3 child protection centers designated by the state. St. Peter's covers more counties than any other of the remaining three. And then certainly here on campus, we have our oncology practice in cooperation with Asterra Cancer Care, and we have radiation oncology and hematology and oncology services and our infusion center. And then up the road, a couple of miles from the hospital here, we have the Health and Wellness Center at 562 Easton Avenue in Somerset, and head and neck, ENT services are there, adult and pediatric ENT and head and neck, as well as physical therapy, occupational therapy, services that are there. So again, a very comprehensive center. If we keep going, there are more outpatient centers serving the community in New Brunswick, here on the left in New Brunswick, in Piscataway, in Monroe, variety, both primary care and specialty services in Somerset, up on Veronica Avenue in Somerset, again in the middle of this slide, and then again in New Brunswick on Easton Avenue with vascular surgery and general and other services are there, and in Milltown, and then also in East Brunswick and North Brunswick, a variety of different services that are there. Going to the next slide, and again, this is all about, what is St. Peter's role in the community and our presence and the services that we provide. And again, services are provided to patients at St. Peter's, irrespective of their ability to pay. But we are down in Lakewood with gastroenterology and internal medicine and midwifery services there, and Freehold with various specialty services and nephrology, adult medicine and ENT and pediatric surgery. Also in New Brunswick here, nearby the hospital, additional specialty services in pediatrics. In Somerset, again, back at Veronica, we have more services in South Plainfield and Monroe. As far north and east as Hoboken, where we've had a long-term relationship there and presence in the community in Hudson County. And the Children's Hospital at St. Peter's historically receives more than 500 transfers into St. Peter's for inpatient services from the various areas, be it in central New Jersey and Hoboken and other parts of the state. So again, as a referral center, we have a lot of activity here. Switching a bit, pivoting a bit to some of the things that we did in the past year. Last year, we literally not just dedicated, but when we have new facilities, we are blessed to have Bishop Checchio come to St. Peter's and literally bless our new facilities. As a Catholic hospital, we do that here. And so this is the new Radiation Oncology Center. This is actually that center we have a new CAT scanner there for simulation to develop treatment plans. And again, it's a comprehensive center both here on this side of the street at St. Peter's in the hospital, and also across the street from the hospital in our cancer center there, that building. And last year we invested some $13 or $14 million in these new facilities and state-of-the-art equipment. Most cancer care is delivered locally in community-based programs. Certainly we take nothing away from the role that major regional and national cancer centers play, but most cancer care is developed and delivered rather locally in community hospitals. And St. Peter's, working collaboratively with Asterra Cancer Care and other community oncologists, has a very solid and comprehensive community-based cancer program that we're very proud of, and that continues to grow and build, and especially in the relationship that we have with Asterra. So as we keep moving, We'll be expanding our adult and pediatric ICUs. Literally, we'll be engaged in a new 25,000 square foot renovation of the hospital's literally adult intensive care unit on the 5th floor of the hospital, and we'll also be building a new expanded pediatric intensive care unit. These projects are now underway. You know, certainly what we call enabling projects that have to be done to enable our ability to go right directly into these areas to start new construction. But these are very exciting projects. The adult ICU will be named for Elizabeth and Joseph DeMarco for a $1.5 million contribution that's coming from the DeMarco family. It's had a long history with St. Peter's. The DeMarco family is certainly part of our St. Peter's family, and we're grateful for their donation to what will be close to a $25 million project. And the ICU for children, you know, is another $12 million project or so, and $10 million of that is coming from a state budget appropriation, which we're grateful to our legislative delegation and especially the Speaker of the New Jersey Assembly, Craig Coughlin, for securing that, and certainly our local assemblymen and state senators that are within our delegation. As we continue, the Family Health Center has had a tremendous investment. I mentioned about the services that are there. I'll talk a little bit more about it later on in part of our addressing social determinants of health. What you could see here is the picture of the market that we have, that we provide food and, you know, wholesome food for those in need in our community. But the Family Health Center is a very important facility that serves those that really have greater needs. Most often are either covered by publicly funded programs or have no health insurance at all. And again, for as much as St. Peter's does as a Catholic hospital with a very strong charitable mission, throughout St. Peter's, that mission is fulfilled. But I would say if there was one place more so than any one in a concentrated way where that happens, it's at the Family Health Center right here out in the New Brunswick community with those who have the greatest needs. Last year, we had more than 70,000 visits. We're on track this year to have over 80,000 visits. So clearly there's a need in this community, and St. Peter's is proud to fulfill that need. So some other things going on in terms of meeting the community's needs is at the Family Health Center within the pediatric and the children's services as part of the Children's Hospital at St. Peter's and its presence out at the Family Health Center. We received an outstanding provider award for the 4 counties here from the New Jersey Department of Health for the very, very important role that we play in vaccinating children, especially those that might not otherwise have access. Very, very important. I know there's some noise, I'll just say some noise in the system about the value of vaccinations, and that's been, you know, discussed nationally. For us, it's a very, very important issue. These vaccines protect children, you know, with diseases such as pertussis, you know, diphtheria, varicella, measles, mumps, rubella, RSV, meningitis. This is very serious health care. And last year, nearly 31,000 vaccines were administered to children in this community at the Family Health Center, and we could take great pride. Staff there does a great job. Next, moving on, we have a very strong focus on the social determinants of health. Not going to read all the narrative that's on the slide, but this work includes really screening you know, a good portion of the community so we can understand what's going on and what's driving some of their health. You know, people's health status is not necessarily, you know, only driven by medical circumstances. They are environmental. That's why we refer them as social determinants of health. And if you look on the next slide at some of the metrics associated with this, we do a lot of screening. And, you know, if you look at some of the issues that are uncovered through health screening, they often relate to things that are not directly a health condition, but they're situations and factors, you know, and determinants that are influencing one's health status. And these have to do with education, they have to do with transportation, and transportation having access to healthcare, to food, it has to do with housing arrangements and conditions, and, you know, whether or not people have the ability to pay their bills or not. Domestic violence, you know, can be a factor. So these are the kinds of things when we talk about screening and understanding, you know, what's driving health status. You know, these are the kind of factors that we're looking for. Last year, we screened almost 1,300 people that we felt were at higher risk. You know, and so that's some of the work we do as an example. You know, getting transportation to the health center is very important. Last year, we provided over 6,600 rides, be it through Uber or other grants that we have to provide rides here to St. Peter's Family Health Center. You know, so again, these are very important. On the next slide, you know, coming back to the market at St. Peter's, literally, this is, you know, food, it says food is medicine. You know, sometimes we say food by prescription. We're helping families and individuals that are at higher risk to assure that, you know, we can help them get the food that they need. And not only, you know, are we doing this because they're at higher risk, but we're also doing this so we can help people advance in such a way where they can have access to education, access to nutritious food, access, you know, for jobs that they might be qualified for here at St. Peter's as well, and providing, you know, basic household items that are important to lifestyle and needs, you know, as identified here in the fourth bulleted point here, you know, that other things besides nutritious food. So there's a lot that we're doing that helps support good health that's not necessarily direct medical care. You know, I always like to say that St. Peter's has as an important part of its mission being interwoven with the social fabric of the community here and working with various community-based organizations, and that's what we do. If you look at on the next slide, again, I'll leave this up here so that you could see this, but we do have our mobile health van. We're out in the community with screenings for blood pressure and other aspects of health. We do provide care not only right here in New Brunswick, but also in a number of adult communities in Middlesex, in Monroe, flu vaccines, and, you know, just a lot to be out there. And you can see here our van and the team. We also work, as noted on the next slide, in with Healthier Middlesex. That's a not-for-profit here in Middlesex County, where St. Peter's and Robert Wood Johnson University Hospital, we work together in collaboration to serve the community, and also with a variety of other community organizations that we're all working together as part of our work in the community health improvement plan that we work collaboratively to develop and do, as outlined in the first bullet. This is all important in identifying what the needs are in our communities, and we work together to do that. As an example of that, if you look at our community health improvement plan, one of the areas that was identified is disparities in care. And so this is an important part of our plan. You know, often based on socioeconomic standing, you know, people don't necessarily always have the same access. Our goal here at St. Peter's and working collaboratively in the community is to make sure that people, irrespective of who they are, what their financial means are, or their racial or ethnic background, is that they have equal access to high quality care that anyone might have access to that has insurance. And so these are the kinds of things that we do, you know, with access and focus on mental health and substance abuse, financial insecurity, and housing instability and food insecurity. You know, these are the kinds of factors that influence, you know, health. And if not addressed, could influence and impact other than good health. And then people come to the emergency room and are in situations where their health is has been impacted in a negative way, where it otherwise could have been improved, and where certain conditions could be avoided. So probably the best example of that is prenatal care. On the next slide, you know, again, by some of the numbers, you could see how our community health needs assessment and then plan is ultimately developed, you know, by survey and focus groups, and a very, very extremely detailed review of data, and then, you know, literally talking with people in focus groups is how we do it. And again, we work very closely with the community. You may not be aware of this, but the Mexican consulate, the only office of the Mexican consulate, is based right here in New Brunswick. And we work very closely with the Mexican consulate, you know, right here in the work that we do, and any number of other community-based organizations that we work collaboratively with. On the next slide, again, you know, we'll provide this for information, give you a chance to, you know, review it, you know, in looking at, you know, the themes and where our focus is. But, you know, we share this information, even though I won't read every word on the slide here and give you a chance to look at it. But again, it's really to emphasize and make the point of just how in-depth we focus to look at the needs of those in our community that, you know, are most vulnerable to, you know, to circumstances that others might not be. And so, you know, this is how we go about it, you know, and at the top of, you know, the page, you could see some of the you know, the names of some of the organizations that we work collaboratively with in doing this. And then if we go to the next slide, again, some of this I've mentioned about the focus on behavioral health, food insecurity, access to health and social services. And, you know, we're at this on a cyclical basis, constantly developing plans, updating plans, and executing plans. We work very closely with the city, with Mayor Cahill and his team. We support projects, one in particular with Coming Home New Brunswick, to support caseworkers to help improve health status for homeless here in New Brunswick, and some other things that we're working with the mayor and other community-based organizations. So this next version of our plan will be completed and done in the fourth quarter of this year. And again, this is a constant cyclical planning process on an every couple of year basis that's constantly being reviewed and updated. And so with that, that brings me to the end of our presentation. We've got a lot of information online in our website. In fact, our financial information is there on our website that was earlier in the presentation, as well as we're very active on Instagram, Twitter, LinkedIn, Facebook, YouTube. There's various sources, and maybe not quite infinite, but extensive amounts of information that are available, for the community to help them access care and learn more about what's here at St. Peter's. We're here to serve the community in the context of our Catholic mission, and that's what we do. So with that, I will stop there. And the way this would work is that, again, you see the picture of our campus. The way this works is because we're not on an open mic, there's the ability, I think, to go to the Q&A on the webcast, and Lisa Drumbor, who's with us here in the boardroom, will see if there's any questions, and we'll convey them, and we'll answer them. And whether there are questions, comments, thoughts, whatever that might be, we're happy to hear from you. And again, we're glad to be able to share this information with you today. So Lisa, do we have any questions?
We don't have any questions at this moment. As we wait, I would like to share with you that joining us also was Dr. Malhotra, the president of the medical staff.
Thank you. Yeah, and welcome, Dr. Malhotra. We're happy to have you, as president of our medical staff of over 900 physicians. And as I mentioned earlier, Dr. Maureen Cernadas, who actually is also on our board, and is an OBGYN physician. Dr. Malhotra is a pediatrician. So they're both very committed members of the medical staff and have been at St. Peter's for many, many years. So we're glad to have them and representing the medical staff and as members also of our board of trustees. So thank you for being with us today.
Yes, we do have a member of our community who is also a member of the press. I know you have raised your hand, but we don't have the ability to activate the sound. We'd be more than happy to answer your question if you can just type it into the Q&A, and we certainly can wait a few moments if it will take time for you to ask your question of us.
Yeah, so please do. Please do. Do we have anything else there?
We don't have anything else. Again, anybody wanting to make comments or ask a question, more than welcome to put that in the Q&A section for us. We value the collaboration with our community, and this is our opportunity to engage with you.
Michael, how many people do we have online right now? 40. 40, great. Okay, thank you. So nothing yet in question. We want to give a person a chance from the press that wanted to ask a question, so we'll give them a chance.
Absolutely. As we wait, there is a question regarding the merger with Atlantic Health and possible, consolidations in, operational systems or other related HR solutions or finance.
Sure, yeah, I can comment on that. What we anticipate, certainly when we think about operations, because that's a broad context, and I'm going to separate operations from clinical services. Yeah, there'll be a lot of collaboration with them. We will be building, and we are in the process of building, so that we can transition to the Epic electronic health record, and we are working on that, very, very actively. And so that would be an aspect of, for those of you that are at the bedside, physicians and nurses and others that access the patient record. Epic has distinguished itself as probably the market leader of any electronic health record, and many are beginning to standardize and use it, to a great degree. I mean, in our area, many of the other hospitals use Epic. So we'll be migrating to that. and then eventually we will, probably within the first 2 years of, completing a merger, then other systems, you know, that we have for our financial systems and systems for human resources that support those functions, they will also, be where we will go on to the Atlantic Health, platform. In fact, you know, one of the things that is very helpful that we can do with them to a much greater extent than we could have done, or would be able to do on our own, is really building a completely new, information technology platform, or an IT ecosystem, if you will. You know, very, very substantial, where all of our systems, clinical systems, will eventually tie into Epic, and then certainly, you know, our other financial and other systems will also be replaced, and, you know, tie in with Atlantic on what's known as the Oracle platform. And so, yeah, a lot of excitement to come, and a lot of work, you know, frankly, a lot of work. As far as clinical services, I don't anticipate that we will, in a sense, consolidate services where we would eliminate something here to have it there. You know, remember, if you look at Atlantic and where their hospitals are, their hospitals, the closest hospitals that they have to us, affiliated, would be CentraState, you know, in Freehold. And then as we go further north, there's Overlook in Summit, Morristown Medical Center in Morristown, and then Chilton is in Passaic County, and I think Pompton Plains. And then further west, they have Hackettstown out Route 80, and also Newton Medical Center that is up in Sussex County. And so when you look at St. Peter's and you look at their geography and ours, and not only hospitals, but then the network, the ambulatory network, you know, it would really be a very nice, you know, geography, if you will. And so more so, much more so than consolidation, will be the opportunity for growth and development and expansion, and further critical mass, you know, that we wouldn't otherwise have on our own. Other questions?
Yes, actually, we do have two reporters from New Brunswick today. One of which is asking why the meeting is being held on Zoom with no in-person option, and did have clarification around why we weren't allowing them to unmute and ask the question. Zoom does allow for this, but the manner in which we scheduled this as a webinar,
Right.
just because sometimes there is a great deal of background noise.
Yeah.
But Les, would you like to answer,
Sure, I could answer
why
that.
we're holding this in?
Yeah, just for transparency with the schedule and trying to get the meeting scheduled, and our ability to have the meeting and do it in the context of the, when the state requires us to do that, and really the fact that the facilities here, our conference center, was not available because of the medical education and other things going on there. Rather, while we would have preferred to have it in person, that's why we chose to do it virtually this time. And I don't know if I don't think on a webinar here we do have the ability right now to open it up, do we? So we can't. So then if we do have the ability, then
Like, we could call on it, we can allow somebody to talk.
we can allow somebody to do it. Can we allow the person who's asking to do that? If we have the ability?
So, yeah, we have two
Yeah, 'cause
two
I'm
reporters.
certainly willing to do that. But again, that's the answer to your question. So let's see if we can figure out how to open up the mic, and we'll let you ask your question.
You have those two names,
Charlie, right?
Charlie and Madison. So Michael will
Yeah, let's do that. We'll give you
look
a chance
to try to
do
engage
that.
your mics, and while they are doing that,
Any other questions while we're doing that?
a lot of comments from the community about Thanks for your support of the Family Health Center and the importance of the community benefits.
Yeah.
Thank you for hosting this meeting. Always grateful for your transparency and supportive nature. And now if we have those two in, Madison is up first.
Yeah, go ahead. Then where's Madison from?
Both reporters are from, New Brunswick today.
Okay. So who do we have? Madison?
Yes. Can you hear me?
Yes, I can.
Perfectly,
Yeah,
thank
great,
you.
Great, yes.
Wonderful. So I was just wondering if you could address how the cuts to Medicare and Medicaid will affect you as a safety net hospital, and what the plan is to
Yeah,
try and continue to serve poor members of the community.
Yeah. So the question is how the potential Medicaid cuts would impact St. Peter's and whether or not we continue to serve the community. Is that your question, Madison?
Yes.
Thank you. Yeah, thank you for that question. It's a great question. And certainly those of you that are in the media know because you follow the news as much or more than anyone. But there's a lot going on nationally. You know, we're waiting for the outcome of what happens. I'll try to answer this as simply as possible. First and foremost, St. Peter's is committed to our mission, to its mission, and we will continue to do everything that we can to provide services to everyone that needs those services that depend on St. Peter's. So while we're watching the situation closely and we're concerned about it, you know, certainly it's our full intent to continue to provide services and do everything we can to maintain services at the current level and frankly continue to expand services as we have done. So that's, you know, a general intention that we have within the context of our mission and being the charitable organization that we are. The other thing is this, when you look at the cuts that are there and the worry, and I'm not minimizing this in any way, what remains to be seen really is how many people would be affected that would fall off of the Medicaid rolls. So there could be some that fall off because of work requirements. There could be others that fall off having access to health care insurance because they're no longer getting the tax break that allows them to buy insurance at a discounted rate through the exchanges. That could result in people coming to St. Peter's and our level of uncompensated care going up, but yet we serve people irrespective when they come. So that's an unknown. And then there's also some of the funding streams. You know, Medicaid is a patchwork of different approaches to and funding mechanisms that make up Medicaid funding in total. You've heard reference to provider taxes, probably in state-directed payments. And the reason why these exist, and I refer to them as part of a patchwork, because Medicaid in and of itself, if you look just at Medicaid rates, only cover about 65% of the cost of care. So what Congress has done over the course of many years, and New Jersey has actually just begun over the last several years to avail itself of these various mechanisms where if the state, through whatever means, either by taxing citizens or frankly taxing a hospital, those funds could be used as matching funds to draw down federal funds from the government. Some of those funding mechanisms are in question, and some of our legislators, you know, the most conservative and hawkish, if they had it their way, they would do what they could to eliminate those completely. Well, that would endanger the safety net nationally, not only in communities like St. Peter's that are urban centers, but it would also imperil communities that are in the heartland of this country. And if you look at it in a political sense, in Republican districts throughout the country, not only Democratic districts, you know, there are people that are less advantaged and economically, you know, certainly, you know, that struggle not only in urban areas in the country, but also in rural communities. And rural hospitals would be in danger. So it remains to be seen what's going to happen. Our best read right now is that it's very possible that these important funding mechanisms that impact hospitals directly, provider taxes and state-directed payments, will be protected in some way and grandfathered in. And so if that's the case, we could come out, very well. And the reason why I say that, or reasonably well, would probably be a better way to put it. There's some parts of the country where some states have availed themselves and maximized those programs to the greatest degree. So if you're already at a maximum, and you could see where my left hand is, and if if a state is availing itself at a maximum and then is rolled back to a lower percent, that's actually a net loss. But if you look at where New Jersey has been, and now you look at my right hand, and New Jersey has not availed these funds, availed itself of these funds to a maximum level like some have. And if we move a little bit more toward that maximum, but at an amount where the federal government has rolled it back, well, we've never been to the point where we've had maximum access to those because our state just hasn't done that. Various states have approached this in different ways. So for us, we could, actually end up in a situation where we're not having the kind of losses that other states might feel. So it depends on how that's going to work out in the final, legislation that goes to the president's desk. That remains to be seen. And that's what we're waiting on. So again, I've tried to take a complicated situation and explain it in as simple terms as I can without getting, mired down in too much detail where I might lose you. But I hope that gives an idea generally, at least a conceptual level of how, we may be affected. But we are committed to our mission, and that's what guides us ultimately, is our mission as a Catholic hospital.
I appreciate your
Michael, were we
answer.
able
Thank you.
Oh, thank you,
thank you.
Madison.
Madison, did that answer your question?
Yes, although I was wondering if you wouldn't mind addressing Frank Pallone's conference that he held at St. Peter's, where he did say that there's no way for the state of New Jersey to absorb the $3.5 billion in cuts into its budget next year.
Right. Yeah. Again, I'm not going to speak for the congressman, but I simply would say this: and this is where the greatest concern has been, and I appreciate the congressman's concern, because if it was allowed that these cuts just went in without the pushback that we're seeing across the country, and I also serve as a member of the Board of Trustees of the American Hospital Association that represents hospitals and ultimately communities throughout this country. If there wasn't the voice of the opposition to these cuts, and these cuts just went in, there would be that kind of devastation that would occur. And yes, it would be a question for not only New Jersey, but other states. How does a state make up that money? And so again, in the end, the question is, what is the final legislation? Where are the compromises, and what are the compromises? Not just where they are, but what are they? And how does that ultimately impact New Jersey and other states when you look at what actually is passed into law? So, when a congressman like Frank Pallone, or even other Republican Congress men and women, I just looked at a letter. I saw a letter yesterday that 12 Republican congressmen, I think it was all congressmen, I don't think there were any congresswomen on that list, but 12 Republican Congress representatives in the U.S. House of Representatives signed a letter to both the Speaker of the House and the leader in the Senate about how important Medicaid is. These are Republican Congress people. So it's an issue on both sides that if left unfettered, yeah, it would have a devastating effect. And that's why there's this outcry by both Democrats and Republicans, some Republicans, about, this issue. And then, there are always those that are fiscal hawks, and they take a different point of view. And again, the yin and yang, yin and yang of these things is where it ends and where the compromises are and how we go forward, and hopefully not have communities devastated. And that's what remains to be seen as this goes through the process. So I hope that sheds a little bit of insight. Believe me, we're keeping a very close eye on it, and we're not
I'm
passive
sure.
about this.
All right. Thank you.
Welcome. What else do we have here? Any other questions come in written as we open it up for Chuck or Charlie?
Just wanted to clarify that we were able to unmute, for Charlie also from New Brunswick today. If you still had additional elements of your question, or wanted to add anything, relative to what your colleague asked.
Yeah.
Charlie, are you with us?
Yes.
Great. Thank you so much for the presentation, and thank you for working to make it so I can have the floor and, ask my questions to you in real time and get answers, hopefully. I'm interested in, I attend the other hospital in the city, had their annual meeting. I've attended, yours for the past few years, and I know that parking is always an issue. I wanted to see if you had any plans or insights about the demand for parking. I know it was something that came up last year. I didn't hear it this year. Apologies if I missed it. Could you tell me a little about that?
Yeah, well, it wasn't the reason why we had the meeting virtually, but at least you didn't have to worry about parking, because parking does always seem to be a challenge. I appreciate the question. So one thing I can say about parking is that later this year, we do have a plan. Of course, we have to go and get full approval by by the city of New Brunswick, and we will work collaboratively with Mayor Cahill and council and any other authority that is required. But we do have a plan to take down the old Votech building that's located right here on the corner of Easton and Park. So, Charlie, it is possible that we will build some parking facility there. We haven't fully decided, and this is part of our planning with Atlantic Health. And what I didn't go into detail earlier when I talked about with them, but part of the reason why hospitals like a St. Peter looks for a partner with greater scale is to hopefully have greater access to capital, not only for the innovation and the technology that I described before in the electronic health record, but also, when it comes to bricks and mortar and the facilities that we need both on campus and, in the ambulatory environment. But one thing that we are looking at very seriously over there would be an additional parking structure, or at a minimum, if we decided not to build immediately, the addition of some surface parking. But my sense is we probably have a need for a parking structure more so. So please stay tuned. We'll have more to say about that, hopefully later in the year and as things evolve.
Okay. Well, that does anticipate my next question. I was going to ask about the old Votech school. I believe it's the first in the country, and many New Brunswickers are eagerly anticipating news of what might happen to that site. So I look forward to hearing more. But yeah, I do think there could be value in preserving the building. But yeah, definitely value in either developing or preserving the site, since it's been sitting vacant for some time. And the only other question I had for you was, I just wanted to ask if the board members who are with us on the call could just introduce themselves. I don't know who is still here.
Well, let's see. I don't know who we still have here. I did, if you were on earlier, I did mention who had joined us.
If you want, Charlie, we can provide you with that information. We can email it to you, or Les could just read it right now.
Yeah, I mean, the
You
people
want
that
it.
were with us earlier, I don't know if they're all with us. We had our board chairman, Vincent Dix, Judith Caruso, Dr. Caruso, who's a very well-recognized nurse leader that's on our board. Dr. Cernatus is past president of the medical staff. That's Maureen Cernatus. Let's see, we had Reverend Monsignor Fell. We had Father Jay Toborowski. We had Rochelle Fosu, and we had David Samuel, and we had Dr. Naveen Mehrotra, who's the president of our medical staff right now. So that's who was on at least earlier. I don't know if they're still there now. Charlie,
Great.
do you have any other questions? I could.
No more questions.
back.
I'll just close with a comment. Wanted to say thank you for the presentation again. Thank you for the thorough answers. And, you know, moving forward, I would hope, that you continue to offer a remote access option at future meetings like this. But, you know, next year would hope that there's also an in-person option. It's the best of both worlds to be able to offer both. And appreciate you, putting me on today and taking my questions.
Yeah,
Thank you again.
Yeah, as I said, that would have been our preference. Would have absolutely been our preference. And, we had some internal issues here that prevented that. So our apologies for that. We appreciate and are also sensitive to that. And so I appreciate the comment. So it's well taken. Thank you. Anybody added a question?
No, just comments about thanks for all you do for the community. Thank you for the questions, allowing us the time to address these issues that affect New Brunswick.
Well, thank
And
you.
no other questions.
And for those, Charlie, you and your colleague, any other question from you? Okay. All right. Well, then sounds like we've covered things for today. So again, thank you very much for joining. Thank you for your support of St. Peter's. Our commitment is certainly steadfast and something that is just in our DNA, to be quite blunt about it. And that's what we're committed to, is our mission as a Catholic hospital and doing what we do in the community and what St. Peter's has meant to New Brunswick and this area in Central Jersey for literally the last 118 years. So thanks again, and we appreciate you joining us today. Thank you.